What if I told you that you could avoid one of the deadliest health conditions on the planet just by recognizing a few silent signs and making simple changes to your daily routine? Today, you're going to learn how to detect the subtle, often overlooked symptoms that your blood pressure might be dangerously high. And if you stay with me until the end, I'll share the most effective, science-backed ways to lower blood pressure, many of which don't require medication. This video could quite literally save your life, or the life of someone you love. Before we go any further, please note, this video is for informational purposes only and does not replace medical advice. Always consult your doctor before making any changes to your health routine. Before we talk about symptoms, it's important to understand what blood pressure is and how to interpret your readings. Blood pressure is the force your blood exerts on the walls of your arteries as it flows through your body. It's measured using two numbers: the systolic pressure, the top number, which reflects the pressure when your heart beats, and the diastolic pressure, the bottom number, which shows the pressure when your heart rests between beats. According to guidelines from the American Heart Association and the American College of Cardiology, a normal blood pressure reading is considered to be less than 120/80. If your numbers fall below this, you're in a healthy range, and there's generally no cause for concern. However, if your systolic pressure rises to between 120 and 129, while your diastolic remains below 80, you're now in the elevated category. This doesn't necessarily mean you need medication yet, but it's a red flag that lifestyle changes are needed. If you don't act now, by adjusting your diet, activity levels, and stress, it's very likely that your blood pressure will continue to climb. Once your readings hit 130 to 139 systolic or 80 to 89 diastolic, you're officially in stage 1 hypertension. At this stage, most doctors will recommend more aggressive lifestyle modifications and, in some cases, may prescribe medication if you also have other risk factors like diabetes or a history of cardiovascular disease. If your systolic number is 140 or higher, or your diastolic number is 90 or above, you've reached stage 2 hypertension. This level of pressure puts you at significantly increased risk of heart attack, stroke, kidney disease, and damage to the blood vessels in your eyes. At this point, medication is usually required alongside lifestyle changes. Finally, if your blood pressure hits 180 systolic or 120 diastolic or higher, you're experiencing what's called a hypertensive crisis. This is a medical emergency. People in this range are at immediate risk of stroke, heart failure, or organ damage. If you take your blood pressure and see numbers this high, especially if you're also experiencing symptoms like chest pain, shortness of breath, severe headache, confusion, or vision changes, you should seek emergency medical care immediately. Understanding where your numbers fall on this scale helps you take control before the damage begins. High blood pressure doesn't happen overnight. It's a slow process, often progressing from normal to elevated to stage 1 and stage 2, until one day a crisis hits. But by recognizing the stages early, you can stop that progression in its tracks. 7 silent signs your blood pressure may be dangerously high. Let's now go through the subtle signs and symptoms. Some are obvious in hindsight, but they often don't raise alarm until it's too late. Number 1. Persistent headaches, especially ones that feel like pressure at the back of your head or behind your eyes, can be an early sign of hypertension. They are usually most noticeable in the morning and may be accompanied by nausea or blurred vision. According to a 2023 study published in Cureus, nearly 25% of individuals with extremely high systolic blood pressure reported headaches as a key symptom. These headaches occur because high blood pressure can cause blood vessels in the brain to swell, putting pressure on surrounding tissues. If you've never been prone to headaches before and suddenly find them happening more often, get your blood pressure checked. Number 2. Dizziness or lightheadedness. A sudden feeling of dizziness or lightheadedness, especially when you stand up, can indicate that your blood flow is compromised. In people with elevated blood pressure, this may be due to reduced blood reaching the brain. This symptom can sometimes feel like vertigo or a sense that the room is spinning. This might be mistaken for dehydration or fatigue, but if it happens frequently, it could be your body's way of warning you that something deeper is wrong. Number 3. Shortness of breath. You don't need to be running a marathon to feel short of breath. If you find yourself struggling to breathe after minimal activity, like climbing stairs or walking across a room, your heart might be under strain. High blood pressure forces the heart to work harder to pump blood. Over time, this can lead to left ventricular hypertrophy, a thickening of the heart muscle, which in turn leads to reduced blood flow and oxygen delivery. This is why people with chronic hypertension often feel winded during light exertion. Number 4. Nosebleeds. Though not always linked to high blood pressure, spontaneous or frequent nosebleeds may be a sign of a hypertensive crisis. When your blood pressure spikes, tiny capillaries in the nose can burst, causing sudden bleeding. While most nosebleeds are harmless, if you get them frequently, especially when paired with other symptoms, it's worth investigating your blood pressure levels. Number 5. Vision problems. Your eyes are incredibly sensitive to blood pressure changes. The tiny vessels in your retina can become damaged or blocked by long-term hypertension, leading to symptoms like blurred vision, floaters, or even complete vision loss in severe cases. This condition is called hypertensive retinopathy. It's not just an eye issue, it's often a sign that the rest of your body is also under vascular stress. A dilated eye exam can detect early damage, and in many cases, prompt lifestyle changes can prevent further deterioration. Number 6. Chest pain or palpitations. Chest tightness, pressure, or irregular heartbeats can occur when your heart is overwhelmed by high blood pressure. When your arteries are narrowed from chronic hypertension, your heart struggles to pump blood efficiently. The result? Angina, heart palpitations, or worse, a heart attack. Palpitations can feel like fluttering, pounding, or a skipped beat. If these are new or worsening, seek immediate care. Number 7. Fatigue, weakness, or confusion. When the brain doesn't receive enough oxygenated blood due to restricted blood flow, it can cause mental fog, fatigue, and in some cases, confusion or disorientation. This may present as forgetfulness, trouble concentrating, or a general sense that you're off. In more advanced cases, especially during hypertensive emergencies, people may also experience numbness or weakness on one side of the body, a precursor to stroke. Pay attention to fatigue that isn't explained by overwork or poor sleep. It might be a red flag from your circulatory system. What triggers high blood pressure? Understanding what causes high blood pressure is just as important as recognizing its symptoms. Many people don't realize that certain everyday habits and underlying health conditions can steadily increase blood pressure over time. sometimes without any obvious warning. One of the most common contributors is chronic stress. When we're under emotional strain, the body releases stress hormones like cortisol and adrenaline, which cause blood vessels to constrict and the heart to beat faster. This response is helpful in short bursts, but when stress becomes a regular part of life, it keeps the body in a state of heightened tension that can lead to persistently high blood pressure. Similarly, intense anger or emotional outbursts can cause temporary surges in blood pressure that may become dangerous if they happen frequently. Thyroid disorders, both hyperthyroidism and hypothyroidism, can also influence blood pressure. An overactive thyroid speeds up heart rate and increases cardiac output, while an underactive thyroid can lead to increased peripheral resistance in blood vessels. In either case, blood pressure may rise. Other underlying medical issues, such as chronic kidney disease, are also closely linked to hypertension. The kidneys regulate fluid balance and filter waste. When they're not functioning properly, excess fluid and sodium build up in the body, increasing blood pressure. Certain lifestyle choices further aggravate the situation. Smoking is one of the most damaging habits when it comes to heart and vascular health. Each puff temporarily raises blood pressure, and over time, the chemicals in tobacco weaken blood vessel walls, harden arteries, and make hypertension more difficult to manage. Excessive caffeine consumption, especially in people who are sensitive to it, can also elevate blood pressure, particularly when combined with stress or poor sleep. Medications can play a role too. Over-the-counter drugs like NSAIDs, non-steroidal anti-inflammatory drugs, some cold medicines with decongestants, and even certain birth control pills may raise blood pressure levels in susceptible individuals. It's always important to review any new medications with a healthcare provider, especially if you're already managing hypertension. Then there are more acute and serious causes. The use of illicit drugs, particularly stimulants like cocaine and methamphetamine, is notorious for causing dangerous spikes in blood pressure that can result in stroke, heart attack, or sudden death. Pregnancy-related hypertension, such as preeclampsia, affects many women and can lead to complications for both mother and child if left untreated. Endocrine disorders, like adrenal gland tumors or overactive adrenal glands, can also stimulate the excessive release of hormones that raise blood pressure dramatically. Finally, some autoimmune or connective tissue diseases, like lupus or scleroderma, can damage blood vessels and increase resistance in the circulatory system, leading to higher pressure. All of these triggers, whether lifestyle-based, emotional, medical, or chemical, share one thing in common. They disrupt the delicate balance your cardiovascular system needs to function properly. Understanding them helps you take steps toward prevention, early detection, and long-term control of your blood pressure. The bonus. How to lower blood pressure naturally, science-backed. Thanks for sticking until the end. As promised, here are the science-backed strategies to lower blood pressure naturally. These aren't gimmicks. They're proven by clinical research and supported by organizations like the American Heart Association, Mayo Clinic, and WHO. Number 1. Diet. The DASH diet, dietary approaches to stop hypertension, emphasizes foods high in potassium, calcium, and magnesium. These include leafy greens like spinach and kale, berries, bananas, beans, yogurt, and fatty fish like salmon. Limit sodium intake to under 2,300 milligrams per day, ideally closer to 1,500. Processed and packaged foods are the biggest culprits, so opt for fresh whenever possible. Number 2. Exercise. Just 30 minutes of moderate intensity aerobic activity 5 days a week, like brisk walking, swimming, or cycling can reduce systolic blood pressure by up to 8 points. Strength training twice per week further improves vascular health. Number 3. Weight loss. Even a modest 5 to 10% reduction in body weight can make a significant difference. That's about 10 to 20 pounds for most adults. Number 4. Stress reduction. Mindfulness meditation, deep breathing, yoga, and even regular laughter have been shown to reduce blood pressure. Chronic stress is not just uncomfortable, it's dangerous. Finally, number 5. Limit alcohol to no more than 1 drink per day for women and 2 for men. Quit smoking entirely. And if you're on blood pressure medications, don't stop them without consulting your doctor, even if your numbers improve. Let's quickly recap the 7 silent signs of high blood pressure. 1. Headaches. 2. Dizziness. 3. Shortness of breath. 4. Nosebleeds. 5. Vision problems. 6. Chest pain or palpitations. 7. Fatigue or confusion. If you experience any of these, don't brush them off. Monitor your blood pressure, talk to your doctor, and take action. Prevention is powerful, and now you know how. If you found this video helpful, share it with someone you care about. And if you haven't already, subscribe to Science-Based Health Facts for more life-saving, evidence-based health content. Thanks for watching. Stay curious, stay smart, and most of all, stay healthy.